For somebody who's been in chronic pain, to have their pain go away without the use of opioids is too good to be true.
Chronic pain doesn't have to be a life sentence, nor does constant sedation and side effects.
Anybody who's been in pain for more than a few days knows it sucks. Now imagine if that's months and years. Now you add on to it PTSD and other things. We've really made a big difference in a lot of veterans' lives.
Not only does this program work on helping me physically not be in pain, but the second place that PRP therapy really helps me is right here. This program gives me an element of control over my PTSD that I didn't have previously. The fact that I'm not in chronic pain lets me be at a different baseline emotionally. They draw your blood, they spin out the good stuff, and they inject it right back in your joint, and the body uses that as healing blocks for the trauma.
And PRP really comes in two flavors, and that's leuko-rich or leukopoor. Leuko refers to leukocytes, which are white blood cells. Leuko-rich has more white cells in it, typically 2 to 4 times more concentrated than in whole blood, so a lot of white cells. Whereas leukopoor usually is like 90% leukodepleted, meaning there's hardly any white cells in there whatsoever. Different tissues respond to different types of PRP. Joints do best with leukopoor PRP, but tendons, the best data is actually for leuko-rich PRP. We're going to be adapting this PRP as we move along. So when we designed the kit, we made it adaptable so the clinician can decide, do they want leuko-rich, do they want leukopoor? And we have one of the few systems, maybe the only system in the world, where it's adaptable within the same kit. So a patient comes in with just 4 joints. Well, you can do 4 syringes of leukopoor PRP. Patient has 4 tendons, you can do 4 leuko-rich. Patient has 2 tendons and 2 knees, you could do 2 leuko-rich and 2 leukopoor, all within one kit.
It's just such a cool program. Shots for Soldiers is life-changing, and these vets can get their function back and play with their kids and their grandkids. And the passion and the purpose that the leadership here has, all of these volunteers are just absolutely amazing, and their vision of spreading this across the country and trying to train MDs that can do it in their neck of the woods, in their state. Why would you not add this to your practice, right? Like, we're all doing joint injections anyways. Like, this is way more low risk, and the evidence, there's over 14,000 articles and studies about this. Like, this has great evidence, and you can change somebody's life with such limited side effects. Like, absolutely, get out here, get hands-on. You will feel comfortable by the end of the training. You're gonna absolutely love your time here. You're gonna leave with a skill set and a sense of purpose that you most certainly didn't have before.
Shots for Soldiers is a nonprofit. Right now, every penny that's raised goes towards helping veterans. None of it goes to overhead, none of it goes to anything else. So we found a way that we can help them and train physicians at the same time. So it's truly a win-win.
I've just been blown away at, one, how just friendly and cordial and funny everyone is, but also how incredibly tough, because shots hurt, especially in joints, and there's no questions of, hey, do you mind if I learn on you? And they don't even flinch.
We've trained physicians from almost every state. We invite the physicians too. They can put on Shots for Soldiers at their clinic. So when we train physician, it's a multi-day procedure. We always do it Friday, Saturday. So Friday, we do didactic lectures in the morning. So I lecture and give the science behind how PRP and PRF works. And then we do on Saturdays, we actually assign a clinician, one of the physicians gets assigned a patient. So we have volunteers that come in to be treated, and they get treated for free. Physicians can get experience processing the kits so they know how they work, but also trying different procedures on live patients. Saturday's your day to get cases under your belt so you feel confident, so when you go back to the clinic, you know how to do everything. And then the fact that you're helping veterans it's just icing on the cake. It's a win-win.
I'm just really excited to take this program home and give back to those who give us so much. Just hearing the stories of the vets that we're doing this, and the insane amount of trauma, like physical trauma, that has been incurred, battered their joints. So it's a very, very rewarding way to learn.
The most rewarding part of my job is Shots for Soldiers. I'm a scientist, I love science, but nothing as rewarding as helping these veterans. So any clinic that wants to do it, please reach out to Enso Doctors or Enso Discoveries or Shots for Soldiers.
You can't put the mind at ease while the body is in conflict. And this won the war over my pain for me. If you can find a Shots for Soldiers doc in your area, by all means, utilize them, ask them to be a part of their program.